Good afternoon, everyone. iTech India welcomes all the participants for today's NDLS session. The topic today is counseling and adolescent living with HIV, the issues and challenges. And the speaker is Dr. Kalpana Datta. Dr. Kalpana Datta, ma'am, is the program director of the Pediatric Center of Excellence in HIV Care and the professor and head of department with the Department of Pediatrics at the Medical College Hospital, Kolkata. She is also the in charge of the Adolescent Clinic at MCH and a national trainer for malnutrition, pediatric HIV, early child development, and the National Tuberculosis Elimination Program. She has authored numerous papers published in both international and national journals. We welcome you, ma'am, for today's session and request you to start the session.
Good afternoon, everybody. Thank you, Shweta, for your kind introductions. Now, I'll be talking on counseling in adolescent living with HIV, the issues and challenges. So, we are awaiting this part. The objective of this session is why we are talking about the adolescents separately, as we have a children and adults. Again, we are talking as third part group of people, that is the adolescents. What's the importance of the adolescent? What is the difference from the children and the adult? Distinct population of adolescents living with HIV and their specific challenges, important aspects of adolescent counseling, process of counseling, and adolescent for adherence and closure. So first is who is an adolescent? So adolescents are the children, according to the WHO and the NACO, we take the 10 to 18, but as a pediatrician in and other groups, they say 10 to 19s. And now there is a proposal of including the young adults up to 24 years in this group. So they are young adults. So that, like another picture, you can see there. I'm 16 years old. It's a boy. It's an adolescent. 15 years old. Teen. And these are the teenagers. 13, 14, 15, 16, 17, 18, and 19. Till 19, they call teenagers. But if you consider the adolescent is a 10 to 18. So as for Ministry of Health and Family Welfare, WHO, now it's increased to 10 to 19 years. And the adolescent constitutes 22% of the total Indian population. And you see what is the burden of adolescents, and we are not taking care of the adolescents separately. We are considering the children. So what is the difference and how will you do it for the betterment of our adolescent children in our country? So adolescence is the period of physical, psychological, social, emotional, hormonal, as well as the sexual development, making them vulnerable to HIV infection, as well as the offering unique challenges in the healthcare. So we are talking about the adolescents separately. So what are the physical changes in the adolescence? So that not only the physical changes, there is a changes inside the brain, inside the body, in the different organs, and what we see physical changes in the externally. So if you see the changes in the boys, first bodily growth, at birth 50 kg, there's a weight 2.5, then 1 year we say the 10 kg, then 12 kg, 40. They go on a different weight band from the different age group from 1 to 6 years. Then 6 to 10, 9 years, they go on the same, they have a different growth pattern. But at the age of 10th year, when they just enter in the adolescence, this sudden spot in the growth spot is there. So sudden gain in weight, gain in height is there, and so for bodily growth would become fast as compared to the previous group. And if you follow the growth curve, there's a two hump. In between, one hump is 5 to 6 years, another hump is 7 to 9 years, but there's a sharp rise in the case of onset of adolescence. Growth of sweat and oil producing glands because of adenarche, especially in a male child. The adenarche, we say, that will start secreting the hormones, and that will give rise this sweat, lots of acne and other problems which may be concern for the adolescent. Development of muscles, masculine structures, the muscles in the shoulder and the other body parts, they will increase in the muscle. Then growth and the pubic hair, the enlargement of pubic hairs in the armpit, in the chest, in the back. So masculine typical distribution of the body hairs in the male child. Then there may be change in voice because of the enlargement of the vocal cord and the other changes in the bony changes because of the muscle. There will be changes in the voice, especially in a male child. Enlargement, the penile enlargement is the first sign of onset of the adolescent in male. Then, and as there is an adolescent goes in the different phases of development, and then after that they will start producing a sperm so they can father a child. So if you see it in the female, again in the female also, in the onset of adolescent, there is sudden growth spot. Not only the weight, there will be the height also, and there will be distribution of fat in the feminine distribution of fat. That means in the waist area, in the hip areas, in the breast, there is thalarchy, which is onset of enlargement of the breast. We call it the thalarchy. And then there will be puberty, then there will be menarche. So there will be onset enlargement of the breast, then there will be a pubic hairs, then there's onset of menstrual cycle. So this is pubic hair, then develop thalarchy, and of course the development of the deposition of fat in different types. That is the feminine type of deposition of fat. It starts from the early onset of the developmental milestone at adolescent. We divide the adolescent in 3 phases actually: early adolescent, mid adolescent, and late adolescent. In case of early adolescent, they behave like a kid, they behave like a children, but they're the external appearance, they are growing and they're very much conscious. In the mid adolescent, there's a conflict, and the late adolescent, they behave like an adult, though they are not adult, but the development is completely completed by 18 to 19 years. In the different parts of the body, there's a differential growth of the body parts, especially if you talk of the brain. There's a in the middle part, in the first early part, there's a development starts in the limbic system, the emotional part and all. That is a hippocampus, amygdala, body, different parts of the brain. That in the mid adolescent, there's a fully development of the limbic system, but the frontal lobe, that means the front part of our head, which determines our judgment power, abstract thinking, decision making, concrete thinking, that takes place in the proper function, the frontal lobe, that matures by 24 to 25 years. So what is the, now you can see, so external physically they have developed, emotionally they have developed, there is a lots of impulsion because of the limbic maturation of the limbic system, but that impulsion, they don't have the power to judge the consequences. So because of that, there's a frontal lobe is still growing, is still maturing, and it will take time to mature by 24 to 25 years. So what they do, they are very much impulsive, they are very much emotional, and they take the steps which may be harmful to them without knowing the consequences. This is the effect of differential growth of different parts of the brain. So adolescents have a physical growth, emotional growth, behavioral changes. In physical, already discussed about the secondary sexual characteristics, rapid growth in the height, voice changes, sexual relationship, and interest. So what happens? Because of the external changes, they are very much conscious of their body. Then they will be conscious of their own image, body image. And because of the rapid growth, the height, and there is a chance of having the autonomy. They want to do, I can do it. It's my decision. So don't follow the parents' decision and all. And this is a normal phenomenon that they will develop the attraction to the opposite sex. And then, of course, the changes in the emotional development, mood swings. Sometimes they are very much aggressive. They always debate with the parents and the friends and the teachers and all, or maybe very depressive. They don't talk at all. They don't want to go to social gatherings, some relatives' birthday or some marriage party. They will say, no, I'm not going to attend that. You go. Parents, they will refuse any social gatherings. So there may be mood changes. Impulsivity, as I already said, they are very much impulsive. Suppose we have seen many times daily, more or less, if we go through the newspaper, we will see one or more incidents there. His father didn't give the mobile, and maybe the child was asking for the mobile, and he didn't get, he committed to suicide. We have many cases in our hospital because of sudden fight with the kid. The parents scolded the older one, means the adolescent, and he hanged himself, and he survived with the spastic quadriplegia. Throughout life, he became the bedridden. So they don't think about the consequences. Just they do the work with the impulsion. Feeling of indestructible won't happen to me. Oh, this is a if you take this is a harmful. No, I am quite healthy, I am quite tall, I am young, there is nothing to wrong with me, I can take it. So they will chances of taking risk taking behavior. idealistic thinking. Always they're thinking this should be done, this should not be done, this is the wrong thing. They will fight for that. So they don't know the real situation, and they're always thinking of the bookish, or some idealism is there in their mind, or they're having some heroes in their mind, and they will think of idealistic way. Individuality, identity at the key milestones, as I already said, they are having they want to have autonomy, they want to have a individual concern, and sometimes they think they are independent, but actually that they cannot take the decision independently. Here I will say that we have to take care of. So third is the behavioral issues. Again, I said with the emotion also, self-consciousness. Always he's very conscious. If he's going somewhere, he will think the surroundings are looking at me. If he's sitting somewhere, he'll say, oh, they are looking at me. So always self-conscious, and how I'm looking, how what dress I will wear all the time, he'll say in the mirror and all. So these are body image, self-conscious are quite common. You don't have to blame why you're doing wasting time in this. No. You have to encourage, yeah, you're looking good. Yeah, no one is looking, everyone is busy. In sort of, you have to give the support. Then the sensitivity and concern over their own body changes. They're very sensitive. Sometimes they may want to hide their hierarchy. So maybe they may become a bit bending the back. They'll walk with the bending backs, or sometimes they may be very introvert. They might be very sensitive with their hierarchies and the development of breast. Sometimes the boys may be very sensitive with their appearance of beard and mustache and all. Strong need for peer approvals also, because they believe in this adolescent, they believe in the peer only. So there's a peer pressure now. So you have to think who are the peers. Well, what is the quality of the peers? This is very important, because if you say something, they will deny, or they will just disagree, or they will have a conflict with the parents. But if any peer or if their friend will say, he will accept. So they are more, very much dependent on the peer. High risk taking behaviors. So they want to do exploration. They want to have do exploration, adventure. So in doing this exploration and adventure, they will take some high risk behaviors. So role of confusion, to behave as a child or an adult. As I already said, there's always conflict, because sometimes they will feel like a kid, sometimes they feel like an adult, and there's a lots of confusion in there. So actually what happens, I give an example. Mm, Actually, if you think of the child who is taking the journey is the adolescent phase, becoming adult. So in a simple language, if you suppose you are transferring you are shifting from a small house to a big house, and this shifting is a adolescent phase. So what happens if you take the decision very properly, rightly, orderly, make a list of the things, furniture, things you are going to shift in the small house to the big house, it will be okay. But if you haphazardly go to the another house, what will happen? Something will be lost, something will be damaged, and again in the big house there will be lots of chaos. So similarly, we are going from the childhood to the adulthood in the phase of transport that is called the adolescent. So if it is not orderly, it is not protected, it is not giving the protection from the parents or guidance from the parents, they may be disordered, and there will be lots of complications when they will be adult. So this is the simple examples I can give. And moreover, they are having the HIV. So what happens if you going through the small house to the larger house through the transport? So there are lots of things have disorganized, and moreover there's a rain. So rain is compared to, you think of rain as HIV. So if there's a rain, your all these furniture things will be destroyed. You compare with the furniture from you compare it with your body organs. So what will happen if they're going through a mature process? In the process, they are in the process, not achieve the process. In the meantime, there is a HIV infection. So it will hamper all the process which is going on. So this is a simple example I can give with the changes what happens from the childhood to adulthood. So adolescent moving towards the cognitive independence are, as already said, confused whether they have the ability to choose and be responsible for their action. Whereas the adults, they're relatively free to make decisions because already mature enough. The frontal lobe is totally mature. They can take the decision, abstract thinking, they can think of the consequences and all. So what are the implications? As I already gave an example, decision opted by the adolescent may not always be right and beneficial. So we, the seniors, the guardians, the relatives, they should guide them to be right and beneficial. Hence, while counseling adolescent, one needs to identify what are the problems the child is having. Respect the identity of the adolescent. Not only adolescent, any human individual, every individual needs some respect from the others. The health adolescent understand the risks and benefits of each decision. So we have to make them empowered so that they can take the decision about the risk or whatever the benefits from the disease or what is the condition they are having. Help them to analyze their desires and needs. So you have to help. You have to ask? I'll say the adolescent when we approach, we say gather approach, GATHER, gather approach. I will say in somewhere. Facilitate the consultation with the parents, family on critical matters and actions. So we do sometimes we don't believe on the children, adolescent. We don't rely on the adolescents if it is having some deteriorative effect on his development. Then we take the parents' decision to get through that problem. So, moreover, as I said, from the there is a problem for the as such adolescence is a challenging phase because it's a transitional phase from childhood to the adulthood. Moreover, there is a HIV infection. So, what will happen? There's a double burden. Problem is the double. So, why we are getting now? We say the new epidemic is the adolescent epidemics. Why? Because now we have the more feasibility, more chance, and the program is having more emphasis on the early infant diagnosis. So we are getting results nowadays. So very early we are getting the results. Previously we used to get 2 months, 3 months after so a long time. So now we are getting so early infant diagnosis there. So more cases are we getting. Others sometimes happen if you are not able to diagnose early, may come in the severe advanced disease or may die without diagnosis also. Then the large scale of expansion of the ART services. It is all over distributed all over the country, and the all the kids and the mothers who are having the positive HIV positive pregnant mothers, they are getting services, and we are following the children also. ART services are quite good, and the drugs are also available, and they are getting. We have a dolutegravir, which is a very good response. So now the survival is quite high. So that also adding the children to the HIV positive infected adolescent. Moreover, the third point is very important point, the sensitization of pediatricians. Previously, we have seen many pediatricians, they don't know even the yesterday also I got one the patient that they said on pediatrician didn't want to give the any vaccinations. So I told her, you just ask that pediatrician to call me and I will make him realize what is the guideline. So still there are lacking sensitization pediatrician, but it has been increased sensitization of the pediatricians. Now they can take the decision and they know what to send, or where to call. Like West Bengal, I say always call me. Even not only West Bengal, the neighboring states also they used to call me from Assam, Jharkhand, Bihar, Manipur. Even Chhattisgarh, they are calling me. So now more and more pediatricians are aware about the disease and they are taking the help. So better care is given to the pediatric children, pediatric HIV, and they are surviving and adding to the as a adolescents. So increasing number of children with the HIV reaching the adolescents is a new epidemic. So adolescents living with HIV as a two distinct populations. We know because one is a vertically infected adolescent, means that the children who acquired the infection through either in the antenatal, natal, and postnatal period during the breastfeeding, called the vertically infected children who are grown up to the adolescent, or horizontally infected children. Means at the adolescent, they are getting the infection through blood transfusions, any organ transplantations, or any injections, unsafe or drug abuse because they're emotionally, I said there's a labile, sometimes maybe in the bad peer groups and they take some drugs and all. So IV drug users may be there, or some sexually abused children, or now we are getting more of the MSA male to male sex children, adolescents at time, or especially in the sexually abused adolescents. So these are the horizontally infected adolescents. Those who have acquired HIV through vertical. So it may be sexual transmission, is a parental transmission. Two distinct type of characters. So there are difference between the vertically infected adolescents and horizontally infected adolescents. So what are those? Likely to be in advanced HIV stage because they are acquiring from the parents, not taken care of, maybe may not be diagnosed. If it is diagnosed in the adolescence, so usually we do get severe failure to thrive, severe malnutrition and all, delayed puberty and all. In case, and there is, as it is lately diagnosed, not taken care of, so more likely to have the opportunistic infections. they will have a growth failure, developmentally delayed, maybe there may be developmental regression also, or developmental delayed also. And so we have seen many cases of failure to thrive children or short stature. So obviously, because of all the complications, malnutrition, they are a higher mortality rate. And as I've seen a 14 years old disclosure of HIV status is partial or none. Here, the few weeks back, I have about one patient, 14 years old child, mother complicated and poor compliance. I said, why are you not taking medicine? He didn't speak. He was very much depressed, emotionally, very much depressed. So I said, do you know why you're taking the medicine? I'm really surprised to know at a 14 years old, he said, no, I don't know. I didn't believe because he might have done, because the age is a very, the adolescent age is still a very curiosity. They are very curious to know about anything. They might have gone through the mobile and Google or asked someone, and might be knowing something, but not might be knowing the real scientific one. So he was very much depressed. And I said, I asked the mother, why didn't you say about the disclose about the children disease? She just kept mum. So we said, we will help you. We asked the mother, we will help you to disclose. So until unless he know the importance of the disease, importance of the taking medications, regular visit to the artist center, proper follow-up, it won't be possible. So we do get lots of cases of the adherence failure and poor adherence only because of the disclosure issue also. Likely to have experienced multiple HIV-related losses. Might have seen the father expired, mother expired, or emotional bad behavior from the family. I have one patient, the child was a 14 years adolescent, mother was a stepmother, uh, his own mother expired, and father was there. So he said he tried to commit suicide once, and once he ran away from the house. Big brother brought the child. Then I asked, why you are doing this? Then he said, my mother doesn't love me. She used to throw the towel, she used to throw the plate while giving the food and all. I don't want to stay with the parents. Then he was very much depressed and all. Then I counseled that boy, and I asked my one of the counselor to counsel. Then also he is not improved and all. So we thought we might give some counseling from the psychiatrist. We have the child psychologist and psychiatrist in our department here in medical college. So I asked him to go to the psychiatry department, and he refused because he thought that is the department of the mad people. I'm not pagal. मैं क्यों जाऊं? मैं तो पागल नहीं हूँ. So I said, okay, the mobile you are taking, what mobile you? If it's a Nokia mobile, the owner of Nokia, the owner of Geo mobile, they used to go to the psychiatry department for their counseling. They want to get counseled by the experts. तो इसमें नो हार्म, तुम पागल नहीं हो, पागल के नहीं भेजे. एवरीवन नीड्स काउंसलिंग. कभी कभी हम लोग को भी काउंसलिंग जरूरत पड़ती है. So I asked my counselor to accompany, and he went there, and now he's taking the medicine. So these things happens in them because of the adolescents. Experience stigma early in life because school, home, healthcare, they are particularly transmitted. That means both parents are mother is a positive, so might get some stigma related issues, might have experienced some bad experience, having the bad memories of these things that can affect their upcoming bringing or this compliance with the drug also. So these things are very important of taking care when we think of the child is vertically infected. And in case of horizontally infected adolescent, they are actually have a normal birth, normal development, early stage is normal, they grow normally, they reach an adolescent phase, then somehow they receive the HIV. So they are usually healthy. I had a one patient, the female patient, she was abused by their uncles and all. Father used to walk outside, and she developed encephalopathy, admitted in a different hospital, and at a battery of investigation, then it was found to be positive, and baby was referred to our center. And she was such a good-looking, chubby cheek, fair complexion, not a malnourished child, but she expired of the HIV encephalopathy. So they are usually having a early stage of HIV. But why is less likely? Because they are healthy. But if you neglect, even after getting positivity, you may go into the encephalopathy. Effect and growth and development is likely because already growth and development, the maturation is going to be in the full-fledged form or sometime might have achieved. So there's, of course, if the less nutrition is good, then there may be chances some mortality will be reduced. If accessing the HIV service, likely no to the status. So this is very important. When they get it in the adolescent phase, they usually have a severe mental depression, severe depression or some psychological behavior, because suddenly he got the that he or she got the infection by some route, and chances of getting knowing about the HIV that he is positive, that may be chances high. There's no question of disclosure. Sometime might be a chance that the parents has to disclose it. Likely to lack the familial, social, and clinical support system, because as the horizontal acquired, that means both parents are okay. They will say, "It's your fault. You got it from somewhere. You did some relationship," or they won't realize if it is a proven fact that after blood transfusion, after infection, after giving injection, somewhere dialysis and all, maybe acquired that infection. Then what happened? Sometimes they may be neglected by the family. Maybe they think, oh, it is acquiring such an infection, it may spread to the other family members. So there is a lack of familial support, of course, and there will be social, clinical support also, because how many centers have an adolescent-friendly health clinic? I'm the lucky one which are having an adolescent-friendly health clinic, and one of the first adolescent-friendly health clinic in India is in our medical college. We are running full-fledged adolescent health clinic. So you need to have a adolescent-friendly clinic for their support, because if they go in a ERT center, you can make fix a day for the adolescents. If they go in a ERT center, the kids are there, small babies are there, breastfeeding babies are there, they will give more priority. If the old age persons are there having a lots of voice, they'll give the priorities. So they are always neglected. The adolescents are always neglected. They feel out of the society. So this is a problem if they are positive in the horizontally. Experience stigma later, exacerbated by the stigma related to drug use and the sexuality also. So there are lots of issues which is maybe different from the vertically infected adolescents. Now challenges faced. What are the challenges they will go? As I already said, challenges of the adolescent, because adolescent is still a challenging phase. It is a transition phase. So they have a lots of problem, lots of conflict in between their inside the emotional level, inside the physical level, hormonal level. There's lots of conflict. Moreover, they are getting the HIV positivity. So it is a sum up and it is a precipitated problem might be there. So like the cognitive capacity, evolving decisional capacity, struggle for the independence. This is I have already explained. A question of authority, need to identify the peers, preoccupation of self-image. All the time he is very much preoccupied with self-image, and of course the exploration, adventurous nature of the adolescent. They can have a risk-taking behaviors. And challenge of HIV, if they are positive with the HIV infection, then over and above the challenges of adolescent, there will be challenges for infection. The HIV has the stigma, discrimination, isolation, chronic disease requiring daily medications, because they don't want to take medication in adolescent, and they are always busy either in the school, career oriented, or doing some job, or somewhere they are not free at all the time they are doing something. So then they might be having lots of problem, that may be physical, that may be emotional also. Long-term morbidities related to both HIV itself and its treatment. Maybe disease itself can cause morbidity, and the drug which I am giving may have some side effects leading to the morbidities. Associated adverse socioeconomic conditions may be further challenge. So the challenges they face, the independency, the sexuality, the peer relationship, and the body image. So all together they will have the problems. So vertically, as I already said, vertically challenge faced by the vertically infected adolescents, so already discussed. So poor physical growth, as I already said, they are failure to thrive, delayed puberty, impaired bone growth because of shorter stature. Then there may be treatment-related side effects. Sometimes we do get, and there are very limited drugs for the pediatric age group. So there is very much problem we do face, like lopinavir, ritonavir. There is a hypercholesteremia, hyperlipidemia, and some drugs are not approved to give the to decrease the hyperlipidemia, hypercholesteremia in below 6 years. So there are lots of treatment issues will be there. Then of course chances of treatment failure. And what I think you should, whoever the audience, they should write what are the causes of treatment failure you have experienced in your day-to-day work in the RT center. You must write in the chat box so that we can discuss, because that there are various reasons maybe the treatment failure, and the main reason is the poor adherence. And the cause of poor adherence, you will be surprised to know there's a lots of issues for the poor adherence. एक ने तो बताया मुझे मन नहीं करता खाने में. There's no issue, but I don't feel like taking the medicine. One adolescent told me, मैं गया था दवा लेने, वहाँ जो केयर कोऑर्डिनेटर था हमसे खराब बिहेव किया था, didn't behave well, so he didn't get the warm, comfortable environment while collecting the drugs, so he stopped taking the medicine. One said कि it's a कितना बड़ा, and 124 years old girl told me, it's not an adolescent, कि I can't swallow the tablet. And you can swallow these, you can swallow your gastrointestinal tract is quite large, you will be able to swallow. Why won't be able to? My tract lumen is same with your lumen. So it is a psychological problem. If you swallow in front of me, I'll see. I give him another medications, which like any vitamins and all, and she swallowed. Then I counseled her and then started taking. So there will be lots of issues of poor adherence. Maybe bitter taste, maybe the doesn't like the syrup, sometimes they don't like a tablet, the sachet, and all those things. So we have to analyze what is the cause of treatment failure, or rather what is the cause of poor adherence. Sometimes not taken by the grandparents, they are staying with the grandparents and they're not taking care of. Sometimes staying with the parents, and parents both are working, he's alone or he or she is alone at home and forgets to take the medications. Sometimes in the evening tablet, sleeps early, or in the morning time sometimes get up late. So these are the issues you will get it if you inquire about the causes of poor adherence, and you have to overcome. Then, of course, the stigma, discrimination, psychiatric behavioral problems, metabolic complications. This is again very important complications because of the wrong diet, wrong life skills, isolations, different organ damage due to the disease and all. You can get the lots of metabolic complications, and bad performance in the school because of the absenteeism, because of the disease, because of the comorbidities, because of the morbidity of drug side effects. Now, there are many issues, maybe some social issues might be there, maybe because of the stigma and discrimination. And recently I saw some in the school, one of the kid in the kindergarten school, and 1 to 2, the lower school, grade primary grade school, the teacher gave the written letter that you don't bring your child to the school because he is positive. And she said, the miss said, why I had to give, because all the other parents of the kids, they gave a written signature. If this child is coming in the school, we are not going to send our kids. So this happened, we gone through in the newspaper recently. So these things might be faced by the kids, and that will go on in the adolescent phase. Then in the adolescent, the commonest morbidity and mortality faces by the adolescents are the mental health issues. It's very important to take care of the mental health issues. Each and every individual adolescent should be counseled about the mental health issues. The impact on the life, career, relationship, because this adolescent stage is the stage where they have to take care of their academics, take care of the career orientation, training, education. So it can have a long-term effect on the life and career and the other relationships. So I've already discussed all this. So challenges faced by horizontally infected adolescents. These are already discussed. Hidden identities, difficult to reach, difficult disclosure dilemma, delayed HIV detections because they are healthy, they are not sick, there are no symptoms, they acquired. I had a patient, 11 years old child going to the school, and he had a school memory failure. He used to forget everything. The teacher complained to the parents that he used to forget in the class, he used to sleep in the class, he used to forget the whatever the task given and all. So there's a cognitive failure was started. So they didn't bother about it, and there is some pruritic papular eruptions, means stage 2. So the teacher referred the child to a pediatrician. Pediatrician was not oriented about the HIV. He gave lots of lots of treatment for the skin lesion. Didn't bother for the school failure and memory loss or cognitive failure. Then he started having myopathy sort of problem, proximal myopathy, difficulty in getting up and all those. Then he referred to some other rheumatologist because there's a proximal myopathy that the child was referred to another hematologist, a rheumatologist, and they investigated lots of things. And HIV is there's a changes in the immunity. So somehow ANA was positive. ANA is a non-specific, and it became positive. There are lots of conditions where ANA will be positive, and they started giving the anti-rheumatic disorder treatments with the high dose with all biologicals and all, and ultimately the child went into seizure and coma. When baby, that adolescent went into coma, the adolescent was admitted in intensive care. There again, a better investigation was done, and that turned to be positive and referred to us. CSA viral load was in lakhs, not the plasma viral load. It was CSA viral load. It was admitted, and as the child was 13 years old. So in our department, we used to get admission from up to 12 years. So baby was admitted in the tropical medicine department, and I used to go to examine the child, and now he is improving. So this is the because of lack of knowledge, orientation, the pediatricians, and baby was healthy, delayed symptoms, and there's a late diagnosis. That's a very important. So delayed HIV detection is very important. You have to take care of that. Engagement and attention in HIV care. Again, the adolescents are very much impulsive. If they will come in the RT center and will say there's a lot of negligency, they are not getting any importance, not having there. They always have a attention-seeking behavior. Always they are very self-conscious. So you have to pay respect to them. You have to think their mental conditions. And if you will ignore them, they will say, okay, you sit and let me take the other patients and all. They will run away from, oh, I'm not going to take the medicine. What will happen? I'm healthy. What is the use of taking ART? I'm not going to take the ART. He'll go on. So retention is very important. So there will lack of retention. मन नहीं किया, नहीं आए, हमको मन नहीं करता है. In that way, so you have to need a counseling from the expert counselors. If the counseling from the ERT center is not possible, you can send it to the psychiatry department because they are counseling daily different peoples and all. So the counseling will be done, and we have a one child in that type of adolescent, and counseling is going on. So lack of adequate youth-friendly testing facilities. Again, we don't have a adolescent-friendly youth-friendly clinics separate and all, because you need to have a separate clinic, separate space, at least separate time or separate day, whatever the feasible you can do in your center. Lack of support and late entry into HIV cure. So common challenges faced by both the vertically and horizontally infected adolescents are adverse family and social environment with a poor support. If the child is positive, they may be neglected. Difficulty to cope up with the HIV and its impact on various aspects of their life, because HIV is a strenuous disease, chronic disease. Moreover, there is a problem with the adolescents and having the other issues of due to adolescence itself, and that will give like to the different various aspects of problems. Mental stress, risk of acquiring deviant and aggressive behavior. Sometimes they may be deviant and aggressive behavior, sometimes they may be depressed also. They may have suicidal tendency also. So different type of mental disorders they might have. Difficulty in coping with the relationship, following protected sexual practices, greater risk of unwanted pregnancy. Educational and career related challenges will be there in the both the groups. So as already talked about the mental health, adolescents living with the HIV are more likely to develop mental health problems, as I have already explained, and adolescents with the mental health problems are more likely to acquire HIV. Why? Because adolescent living with adolescent are still having a mental problems. Maybe that should be keeping in a right track. You have to counsel, you have to guide, you have to protect. Not only you, I mean to say their guardians, they are the adults, the parents, we, the healthcare providers, the society. Everyone should be careful for guiding the right path so that they don't land up in the mental health diseases. So possible causes are social stressors such as stigma, financial difficulties, relationship difficulties, lack of adequate support structures may also be associated with the certain medications with the direct effect of the virus on the brain. As I said, virus encephalopathy in our patient has a 50 lakhs in the CSF, and of course, that some drug can cause some depression and all. Or like in previously, ephedrine can have that insomnia, sometimes depression, mood disorders and all. Adolescents with the mental health issue problems are more likely to acquire HIV. adolescents who are having depressive activity or aggressive activity, they will go in to get the satisfaction, gratifications, or they will do some drug abuse. Maybe they're depressed, so much depressed, they will isolate themselves, and then will start taking drugs and drug abuse and all, and then they will end up with a relationship with the sex workers, or they may be abused by the others, so there are chances of HIV more. So each, the mental health will lead to the HIV more, and the HIV will lead to the more mental health diseases. So counseling. Now the part is counseling. Now we have realized what are the problems of the adolescent with HIV, and now counseling. Counseling is not in a lecture, not in this type of NDLS, not in the seminar or workshop. It is the understanding, make the person understand the consequences of the disease, make him or her empowered to take the right decision. So you have to say both the effects and the side effects, the beneficious, which will be suitable for him, which is not suitable for him, and make him empowered to take the decision. If not, then you can take the help of the guardians, legal guardians. So counseling to make them empowered to take the right decision. So need long-term counseling and support, as I've already said, that they need different type of counselings, accepting their diagnosis. The first and foremost, they are in a denial mode. Don't accept. So how to accept the diagnosis? You have to give the example, what it means to live with HIV, when to disclose the status to others, how to envision their future. So you have to give example. You have to be very empathetic, not sympathetic. Aha, you so sad, you are having a child. Not like that. You have to give example. Like when my adolescent used to come to me, I used to say, no, I'm a hypertensive. I'm taking medications daily. If I won't take medication, my blood pressure will shoot up, and there'll be hemorrhage. I can have a stroke. I can die. So I take regular. Similarly, you have one disease, whatever it name may be, you have one disease. For that, there's a medications. It is not a non-treatable disease. There is some disease in the world which there's no medications. So you're lucky that we have a disease which is having a medication. So take the medicine regularly, you'll be healthy as good as others. So you have to be very empathetic. You have to give example. You have to explain the things in such a way that will be acceptable by the adolescents. Many parents, guardians continue to take key decisions without involving the adolescent. As I've already said, adolescents have the autonomy. They want to be autonomy. They want to have a independency. So you have to take the decision with the adolescent. It's not like in nutrition. Suppose the child is a very obese child. So you will give these some options. Now tell me, you want to take the fruit or you want to take the this soup. Don't give the options. You give the option from them to choose with only those options. And always ask the questions which are to be answered, not by the close-ended answer. It will be open-ended questions. Don't ask, did you eat your lunch? So he will say yes or no. You will, this is not the question. You will ask, what did you have in the lunch? So he has to answer. So the answer should be in a sentence, not by yes and no. And that is called open-ended questions. So you have to ask the open-ended questions, not the close-ended questions. Adolescence, the primary client and focus should be on his or counseling needs. So yes. So it is said when you are going to counsel the adolescent with the legal caregivers, you ask them first, first I will counsel separately, then I'll counsel together. And while counseling the adolescent separately, ideally it is said it should be in a transparent glass. Only the transparent glass will be there. The barrier will be transparent glass, so that adolescent can see the parents and parents can see the adolescent, but cannot hear whatever the discussions going on. And that will give him or her a bit confidence. However, permission from the parents and guardians is essential before discussing issues with the adolescent. So when you're taking the adolescent inside for counseling, always take the consent from the legal guardian. And of course, if the female adolescent is there, then the female attendant might be there. If you're a male doctor, a male person, a male counselor, or this vice versa also to be done. So counseling is, what are the counseling will do? Care and so counseling needs of the the care and treatment, about the care and treatment, about the sex and HIV and life skill. The care life skills for the each and everyone. As he is having HIV, so treatment and the HIV care. About the sex and non-sexuality, this should be also counseled. So care and treatment, understanding the HIV. So first see how much he knows. You ask this. That should be some brainstorming session. You have to ask, oh, do you know what some name the some virus? You are the adolescent. You are reading the biology. You are reading the health science. Any virus. You name some virus. In that way, you can start talking. So then you say there's a HIV virus. If it is already disclosed, or you want in the process of disclosure, so you see how much he understands about the HIV, how much he understands about his illness. So there may be the way of disclosure, partial disclosure, initiation, then partial, then actual disclosure. So if it is already known to him, if you don't counsel, don't disclose, he will know everything, because there's a source is there everywhere. Google source, net source, friends, peers, and all those. So you'll get the wrong information. There will be lots of myths and fallacies and will be diversion. So always better to give the information scientifically, correct information. Okay. So, yeah, understanding of the HIV. You have to say, now this is one virus. You know the rhinovirus, adenovirus. Similarly, you had an experience of the coronavirus. Similarly, this is the HIV virus. So, what is the difference between two? How it affects, how it gets infected, in person gets this HIV infection. In that way, you have just usual common way you have to discuss. Then you gradually come to his illness. Then, as you know, you don't say the life, you have a HIV, you have to take that medicine for lifelong. It's very depressive. But we say, there are many diseases in this world, we have to take the medicine lifelong. Not only the HIV, there is hypertension. If you have hypothyroidism, if you have diabetes, there are lots of disease where the person has to take the treatment lifelong. Similarly, HIV also you have to take it lifelong, and you'll be okay, healthy, and you can lead a normal life. So you have to make them understand about the importance of the lifelong reality. Others, the very first day, we say you have HIV, you have to take the disease, treatment lifelong. He'll be depressed, and he will stop taking. जिंदगी भर खाना है तो मैं नहीं खाऊंगा, जो जो होगा देखा जाएगा, because adolescents are quite healthy and always they take the advantages, they will take risk taking behaviors. बोला मैं जब देखा जाएगा, जब बीमार पड़ेंगे तब देखा जाएगा. So you have to give the example also, because they want the adolescent, they're so impulsive, they want immediate result. So you cannot say that if there's a fever, you give paracetamol, there will be immediate result. But here in HIV, don't get the immediate result. But you have to say something which he will accept. Suppose he is smoking. If you say that smoking can cause lung cancer, he'll say, okay, देखा जाएगा जब हम बुढ़े होंगे तब lung cancer होगा ना, अभी तो smoke कर लेते हैं. They will not stop smoking. But if you say, आप smoke करोगे तो आपका lips will be black, you look ugly, no girl will be attracted. आपको कोई लड़की पसंद ही नहीं करेगी. You won't have a girlfriend, you won't have female friends and all, because तुम्हारा lips काफी black हो जाए. That will give immediate impact. Oh, so because they are very conscious of their look and on the body. So you'll say, if you take this smoke, that is very, actually they think if I smoke, I'll look very smart. So this way you have to give the advice and the counsel them, so that they can get some information, some beneficial information from your counselor. Treatment adherence. Again, I have to give the example. Why the adherence is important. So I give you an example in that way. Some introducers entered in your room, and you are 2 or 3, and there is a 5 people, miscreants entered in your room. What will you do? You will start searching the weapon to counteract. So if you take the medications, it's the same way. That means you will got lots of weapon to counteract. आपके घर में बहुत सारा weapons को निकालना पड़ेगा to counteract the miscreants who have entered in your room. एक घुसेगा तो कोई बात नहीं, ज्यादा घुसेगा तो करना पड़ेगा. Similarly, if you have a viral load high, you have a disease, if you won't take the medication, you won't be able, body not be able to overcome that virus. तो आपको दवा खाना पड़ेगा and treatment रोज खाना पड़ेगा. नहीं तो वो लोग, they will be more powerful and they will overcome you. If you will take the medicines, you will overcome the virus and you will suppress the virus. So you have to give the example and take them, counsel them. Then the disclosure again, as I said, disclosure will be initiation, then personal disclosure, then the actual disclosure. Adolescent, you don't take it granted that this adolescent is a तो बड़ा हो गया है, that is mature enough, I can very first day disclose. No, you communicate with them, counsel the adolescent, see their maturity level, understanding about the disease and the HIV virus, then gradually disclose, and then of course the final disclosure will be done. Of course, the healthy living, how to be healthy, what are the healthy living styles, what is the good mental health, what is the importance of exercise, all those things, routine, timetable, everything you have to discuss. And the nutrition, it is the integral part of management of HIV. So what is the good nutrition diet? What is the balanced diet? You know, we'll say, you know, they have seen the traffic light signal. What are the colors? The green, yellow, red. So in the plate, your plate also should have a traffic light signal: green, red, yellow vegetables, dal, yellow, rice, white, all those. Or other way you can say the rainbow. The rainbow colors in your plate, it should be rainbow colors. So in that way, give the different examples, different things, so that the nutrition, because the proper nutrition is very important to get the ultimate outcome. If the child is getting treatment, there is quite good compliance, is 100%, barely suppressed, but nutrition is very poor, that will mimic as a severe HIV. So you have to take care of the nutrition also, so that they can get the appropriate balanced, nutritionally balanced diet with rich in micronutrients, because micronutrients have an antioxidant property. It imports your strengthen your immunity, so that opportunistic infection can be taken care of. Then of course, as the adolescents, they might have a experience or want to experience about the sex and sexuality, their identity about the knowledge of this. What do you mean by sex? What do you mean by sexuality? What is your idea about these? All those things to be discussed very confidentially and very friendly with the adolescents, to know their ideas. Sometimes what we used to do, we used to do the workshop with the adolescents, and we ask them to write it your questions on the paper, piece of paper. Don't write your name, so there will be no identifications. You just write the questions and give us. I will address the answers. So that we can do with to know the sex and sexuality as they growing up, changing behaviors, the physical external change, the physical changes, internal physical changes. Now they are grown up, they can father a child, they can mother a child. So these things to be taught in the counseling. Then relationship. What do you mean? What is the relationship? Friendly relationship, depth in the relationship, long-term relationship, all those things. What do you mean? What is your idea? And all those to be discussed. And pregnancy prevention, of course, pregnancy, because they want to have a sex, and sometimes they might get. So we have to take the precaution about the how you take, what are the family planning counseling to be done. Even the adolescent health clinic, the contraceptions are available, the condoms and the vesicles are there. So you have to teach them. Don't discriminate her also. You can give the advice to the male child and you won't give the advice to the female child. That should not be done. There should not be gender biased. Then the life skills again, communication skills, you have to improve that, handling the stigma and how to handle the stigma and discrimination. Decision making, you have helped them to take the decision making and planning for future. So you have to talk about that. And if you are not, may not sufficient to give the planning for future or decision making, you can give them the example where to go to get this type of the counseling. So you can arrange them that counseling, the planning, the career counseling, and all those counseling can be given, so that they can have a contact with it. The key principles communication with the adolescents. Okay, so as I said, gather approach. Whenever coming to that adolescents coming to you, that is called gather approach. GATHER. G for greet. You'll say, hello, Ramesh, how are you? Good afternoon. Come to me. In that way, well, he will be comfortable. Oh, the person is calling by name. He's not that. Okay. So he'll feel good. Then A for ask. T for tell them. H for help. E for explain. And last the R, gather. R is very important. R means return, means follow up. So if you behave nicely, if you communicate nicely with the adolescent, as soon as adolescent comes, you will look at his eyes. Don't show him you are too busy. Don't go on writing in the prescription or watch your CEO watch or talking to the our counselors or the doctors or the caregivers or other patients. Give 100% attention to him. Sit in the same levels. Eye to eye contact should be there. Whenever he's telling something, ask them to tell. Why have you come? What do you think? When he's telling, just nod your head as if you're understanding, you're listening to him. Give, oh, ho, acha, theek hai. Bataiye aur bataiye. So he will be encouraged. So these are the few points while counseling and communicating with the adolescents. So then you will see what is their interest, how will you help them to get the medications, how to improve their adherence. You give the clues, the means to improve the adherence. And if there's any issues and their concerns about their, maybe there's his concern about the career, he's concerned with the family members, he's concerned about the their external look, he's concerned about the disease, whatever is his concern, you can talk to them, ask, make them open up. They will open up to you, and then help them to take the decision. Constructively respond to your feelings. As I said, don't judge, should not be judgmental. अरे आपने ये क्या कर दिया, अरे तुमने वहां गया था, ऐ हो गया. So don't do this. अच्छा अच्छा ठीक है, उसका भी इलाज है, उसका भी है. आपने ऐसे किया. If he scored very poor in the exam, आपने पढ़ा नहीं होगा, don't say this. अच्छा अच्छा, next time will be do better. You'll give more time to your studies. So give some importance. So constructively respond to their feelings. And as I already said, nutritional counseling is very important for adolescents because adolescents spend maximum time outside the home, either because of the school or because of the training or because of the coaching or because of the swimming, playing, whatever. They spend many more times outside the home than the inside the home. So always they take the ready-made food, easily available food, easily eatable food, and all those junk foods and all. So always counseling what to take, what not to take, and which is good for you and which is not good for you. So do's and don'ts in the communication is very important. Do's, be truthful about what you know and what you don't know. As I said, you might not be sufficient to counsel each and everything. Say, okay, अच्छा ठीक है, मैं तो इतना बता दे रहा हूँ. अब आपको जो problem, suppose you are not able to treat his acne. Say, adolescent. ठीक है, मैं skin में दिखा दूंगा. I will send someone to the dermatologist and he will get it. So if you don't know anything, you just be frank to him. Be professional and technically competent. You have to empower yourself. You have to because counseling and communication is not a book is learning or mug up. You will read the book, you will mug up, and you will be expert. No, it is a process of learning. You will learn by the time as goes on. The time, so you have to practice and practice and practice. Then you will be perfect in counseling and communication. Be professional. Use words and concepts that they can understand and relate to the essays if they understand. Suppose the child is having, the adolescent is having fever. They said, oh, pyrexia. Don't say the pyrexia. You have a raised temperature, that is your fever. So don't use the difficult words, medical terms, which is not, which is make them difficult to understand. So use simple words, normal terms, no medical jargons. Use pictures and flip charts to explain. You can explain by pictures how the disease spread, how it goes, how it affects, and if you give the drug, how it kills the virus, how it suppresses the virus, and all those can be taught or explained. It's better to use both picture and explanation. So vision and hearing both, if combined together, that learning will be great. Give all the informations and choice and help them decide what to do. So you give them the choices, make them empowered. If you have acne, suppose I'm giving a small example, acne, so you can do wash your clean your face, wash it regularly, and then you can take the medications. If you want to take the dermatologist opinion, you can get it. Let them, but give the choice, which is good for them. Don't give it the open choice. आप क्या करना चाहते हो? ऐसे नहीं. Give the options and let them choose from the options. Treat all adolescents equally. So no gender bias, no, you should not be biased by their social background, educational background, qualification, or the gender. Accept that they may choose to show their individuality in the race or language. Yes. So you have to accept, you have to, you don't criticize anything, just praise, always praise. Whatever, yes, yes, आपने तो बहुत अच्छा किया. आपने hospital, you have come to the hospital, that is a great thing. You have realized that you should go to the hospital, take the medication. So you are very intelligent. You know what to do. So you just encourage and praise the always. Now, what should not be done? Don't give inaccurate informations. Don't show your hurriness. Be comfortable, nod the head all the time, respond his talk. Then threatening to break the confidence for their own good, no, they never do. आपको बोलना चाहिए, नहीं तो आपको गड़बड़ हो जाएगा. Or never do this. Don't give them only the information that you think they will understand. No, they might understand much more than that. So you have to see how much they can understand, what they want to know, how what are the things they have already known. Sometimes they might be knowing everything, but it is a distorted form. So let them speak, then rectify. Using medical terms, they will not understand. So don't use the medical terms or jargons. Telling them what to do because you know best and they are young. Don't think they are young and whatever I'll say, they will follow. No. You just give the options. And they are individual. There's grown up. They have the mentality to think, because the process of adolescence, and they have to have a autonomy, independency. So these things to be respected. Being critical of their appearance or behavior unless it relates to their health and well-being. So don't criticize about the appearance, the dress, if they come with the long hairs, with the earring in the boys, girls in different dresses. No. If it affects their health and well-being, then you can say, if it's taking some lots of tattoos and all, you can say, okay, don't do more tattoos because tattoos will destroy your, maybe there may be skin disease and there may be some other problems. So which can affect their health, that we can ask them not to do or advise them. So using the 5 ways in adolescent health with counseling, assess, advise, agree, assist, and arrange. So first, as I already said during talking, assess the why they have come, what they want to know, what is already known to them, and whether it is scientifically correct or not. So assess his knowledge, assess his environment, assess his concern, assess his mental status, assess the physical status, assess the disease severity, and all those. Then how assess their sexual orientations. So it's very important to know their sexual orientations and knowledge about the sex and sexuality. Other risk-taking behaviors about the HIV, adolescent knowledge, belief, concern about and daily behaviors. This we have to assess. What are the support structures is there, but who will the caregivers, how many members in the family, who are the positive people. All this you have to assess, then you will realize the actual scenario and actual burden of the problem. Then, of course, advice using plain, neutral, non-judgmental, attitudinal language. Correct inaccurate knowledge and fill gaps. As I've already said, you first to assess how much they know, what is their orientation about the disease or the anything. If it's wrong, if it's scientifically not correct, just rectify. On being young and living with HIV, advise what are the things to be done. On sexual activity, condom, as I already said about the contraceptions, then couple counseling and the disclose HIV status, especially the young adults. On peer support and on adherence, you have to advise. Then agree the choose place to receive treatment and support disclose and their status. So this is it's autonomy for them. You give the independence, wait to take the medications. आप कहाँ से लोगे? Wait from you will get the medications. Which is will be more good for you or you want to take. They might hide their identity because they know if I'll go to take the collect the ART from my center, everyone will know the why the adolescents going here. They will everyone, because they are very conscious and they will be more conscious as they are HIV and they are going to ART center. Everyone knows why they are going to ART center. So they might take the medications from some other center. To give the option, wait to let them choose. But you have to help because it may be far away, then you might miss every month. So these options are pros and cons. You have to understand, make them understand. Disclose the status, how and when they wish to disclose their status, on the role that the adolescent and the others and the care and treatment, and on goals that reflect the adolescent priorities. If you say, okay, I'll come in the next month, but my next month I'm having the exam. So that his priority is the exam, the study, and the career, not the HIV. So you can make the things in such a way so they can take the medications and take the advice and with the priority with their or his or her own priority. Then of course assistant taking the decision plan, refer if it is needed, you can assist to refer to adolescent friendly health clinics where they will get the different type of advices, different type of health, different type of counseling, and different type of treatment also. And then, of course, if it needed, you can link them to support services, treatment, and other medication. If it's like obese or there's malnourished or other problems because of the adolescent, like acne and different discharges and all, you can UTIs are there, any penile infections are there and all, then you have to treat all those things. And if there's a use of various methods as a contraceptions, assist them to develop the skill to assist the self-management, care, and adherence. If there's any obstacles, you first assess what is the obstacle for the adherence. As I said, I had a patient say, I don't feel like taking the medicine. I'm like, why? No, I don't feel like taking medicine. No, no reason. I don't feel like. So you have to make them realize what is the importance of taking medicine. The patient and physical, mental, and social health. Then arrange the things where they will get like in the time between the visit to you for the next appointment date. As I said, the gather approach is the referral. So if you behave nicely, friendly, and he's very comfortable with you, he will again come. Not only he will come with his peer who is also positive, like especially in MSM and all, they come one by one they come. But if they feel comfortable, they feel that the staff of artisans are very comfortable to me, and they will take us in a confidence, they will again come. They come without asking you. So follow-up will be better. So it is very important to throughout the scenario will be behave comfortably, friendly, with the proactive attitude, with the non-judgmental, so that they can come. And if you need some referral, you have to help them to reach that referral center for the proper care. Assessment of an adolescent with HIV. Adolescent may not volunteer about health problem, embarrassed, scared, uncomfortable. As I said, might be having the first distress from the penile area, penile urethra, or the scaly oral candidiasis or vaginal candidiasis. They may not say. You ask. You ask, you have an infection somewhere, or in this year, this voluntarily, if they won't say, you have to ask in such a way, they'll open up to you. Of course, the HEADS approach is there. HEADSS. The HEADS approach, where for especially for the HIV and the drug abusers, where how can you get the all the informations through the HEADS approach. The HEADS assessment questions, so the home and education, employment, I'll go in the next slide, so you'll get it. So HEADS approach, HEADSS, this is the acronym of the HEADS, and if you see the H for home environment. So home environment, you have to ask how many people, how the relation, who are the caregivers, how many, if it's a vertically transmitted, who are the other people who are positive and all. Education, employment, environment, all those things to be asked. The eating, what is the meal pattern? If it's a malnutrition, what are the amount of food they eat? Obese, what are the things? How whether they take the junk food or not, and how they feel about dating and all those things to be asked. Then A for activity, what whether they school goers or they're working somewhere while they're not a school goer, not going to school, what they do in the free time, is there any hobbies and all. So it's very important. Every child adolescent should have some hobby. You can give the clues so that they can have it. Then drugs, any drugs other than this drug, any other drug, any abuse like the tobacco, alcohol, any other substance abuse, and sexuality and sex, I already said. Of course, safety. Safety is very important. Home safety, safety in the road, as we say, safety in the roads, and same the home safety, food safety, safety on the sexual behaviors and all, the road safety and everything. Then the suicide and depression, that should be quite over. There is the questionnaires, and so then we'll examine thoroughly as we do in the other cases. A thorough examination should be done, like general examination, head-to-toe examination, and different system examination. Then counseling the caregivers in the adolescent for lifelong learning. Because adolescent itself is not the challenging phase, you have to take care of the help of the caregivers to make them take the drug properly. So preparedness counseling, As already discussed about adherence counseling and follow-up counseling to be done. Counseling caregivers, you have to, for the caregiver, you have to taught the caregiver how to take care of the adolescent, because we know even we had adolescents in our family, we are not able to take care of them. So we have to become ourselves empowered. So similarly, you have to counsel the parents to think about the adolescents, the adolescent inherent problems, issues, and moreover the HIV. So you have to teach them in that way. Counseling about the side effects of the drug. So when you are talking about the disease and you're going to treat the drug, the adolescent, and then there might be some minor side effects. Don't see the severe side effects at the very beginning, because otherwise they'll be scared and they won't take the medication. So you will say, किसी को होता है, किसी को नहीं भी होता है, बहुत सारे बच्चे हैं जिसको नहीं होता है. You might get a small minor complaint. Any complaint you come to us, so you have to counsel the side, but you have to make them aware about the side effects. Counseling in essential. Why it's important to take medications, why adherence is important. So you express vital suppression is very important, and to get a good life, good healthy life, to decrease the opportunity infections. If you decrease the opportunity infections, there will be less comorbidity, so less chance of taking much more medications. So you use interactive methods such as pill chart, storytelling, and suggest various ART reminder tools, including calendar, for the adherence issues, as we counsel in other cases. Here also give the different ways to remember the taking the medications. Now, adherence follow-up counsel is very important after taking medicine. Kitna saal hum khayenge? 2 saal. Usually after 2 years they get fatigue. So you have to counsel, because many diseases you have to be healthy. You want to be healthy, you have to take the medications. As you are taking daily food, you are brushing your teeth daily, you are going to have a bath daily. Similarly, you have to take the medication daily. You are not tired of taking bath, you are not tired of taking medication, food, you are not tired of taking brushing your teeth. Similarly, you don't have to think that you have to take the medication. This is a part of life. You have to take the medication daily. So disclosure, again, already I talked about the disclosure. Disclosure is very important to improve. I have given the example also. Clinical outcome, and if there's a disclosure improves the adherence, that will give the improvement in clinical outcome, less comorbidities, less opportunistic infection, the good health. And then you have to support for the disclosure of their own, who will disclose. They will go through the books. You can take the help of parents. You can help the counselors, the doctors, and all for disclosing. And type of disclosure, as I already said, there's a gradual disclosure will be there. In 4 to 6 hours, see the maturity level, see the disease. Don't say the virus. Then the partial disclosure means say the virus, but don't name. And then full disclosure means just name the HIV and all when they understand the viral disease. So these are the things, the way of counseling for disclosure. Like you are not well, if you want to play, you should be well. So in this way, 6 to 9 years, you have got some germ, you have to take medicine to kill that, suppress the germ. And in 9 to 12 years, you have to say in detail. So the preparation is understand the caregiver's fear, concern, explain the need to disclose, addressing the parents and caregiver's fears, deciding how, when, by whom disclosure will be implemented. So other counseling messages, of course, stigma, difficulty in identifying the HIV negative peers, anxiety, mental health, sexuality, all those things I've already discussed. I'm not going in detail. And you have to link the needs, according to the need of the adolescent, you have to link the services to them. Under NCP, other facility providers, if the NCD screening going on, Hep C screening going on, some STI clinic is there, you have to link them. So this is the last slide of the long presentation. The adolescent defines individuals 10 to 19 years at the transitional phase from childhood to adulthood. It's a journey. Adolescents living with HIV may have acquired HIV both vertically and horizontally. They have mental disorders, different either suppressive or aggressive. Using 5 ways to help them to counsel. Key principles of communicating adolescents is understand their interest, addressing their concerns. Disclosure of HIV status to adolescents is important to improve the adherence. I have given the example, and for the outcome also. Refer to them to additional support required and ensure the follow-up, and always make sure that they have linked to the others additional supports which they needed. Thank you for your patience sharing. Now the post is now.
Thank you so much, ma'am. Yeah, thank you so much, ma'am. Ma'am, we'll skip the e-poll and post test for now.
Achha.
Yeah. Any questions from the participant? Ma'am, can you go to the last slide after thank you? Yeah, yeah.
Yes.
Just keep the slide, ma'am. Thank you so much, ma'am.
Thank you.
Uh, Participants are now requested to unmute and ask questions. You can also put your questions in the chat box. Lakshmi ma'am, you had requested for a session in Hindi. If you can tell me your state, we can coordinate with the COE or the pCoE. Lakshmi Parmar ma'am, can you unmute? Any questions from the participants? Please feel free to unmute or you can put your questions in the chat box.
अच्छा, एक लिखा है ना सर, हाँ
जी
मैम,
जी
हमारे
जी
यहाँ एक लड़की ने नर्सिंग में एडिशन लिया एंड देन था और मेडिकल चेकअप के लिए बोला तो लड़की कहा मैं HIV पॉजिटिव हूँ, तो वहाँ की चला गया।
या मैम, तो वहां की मेट्रन ने
हाँ
लड़की की बाथरूम बाहर और बहुत सारी चीजें सेपरेट कर दी। 7-8 मंथ के पहले ही हुआ है।
हाँ, दैट मीन्स देयर इज अ लैक ऑफ नॉलेज इन द लड़की के ने कहा कि जब तो बात किसने कर दिया, मेट्रन ने। तो
मेट्रन
मेट्रन
ने।
को यू शुड मेक देम, यू हैव टू डू द सेंसिटाइजेशन प्रोग्राम देयर, or you call the matron or the who are the leaders of that organization or that place. You have to make them that aware what are the guidelines and what the scientific reason of that. There's no scientific reason of separating all those things. आपको उनको empower करना है, मेट्रन को भी बताना है, क्योंकि we had a adult person, he came to me and said, मैडम आप लिख दीजिए, I'm healthy है, मेरे पास कोई disease नहीं है, तब हमको नौकरी में रखेगा, नहीं तो निकाल देगा. Then I said, I won't disclose your HIV because HIV is not hampering your day-to-day activity. I can write you are clinically fit. Because externally उसको कोई problem नहीं था, he was quite healthy but HIV positive. I said I can give you the prescription that you are clinically fit to do any job, because he was working in some office, only paperwork, no surgeon or nothing. So you can give that, you can make them understand. मैम मुझे एडोलेसेंट बच्चों के लिए काम करना है और सेंसिटिव साइंटिफिक बेस्ड काम करना है, हाउ यू विल हेल्प मी? Oh, so I don't know, Shweta. We can do the
Yeah,
more
yeah, yeah.
workshops and more webinars. You can add, you can arrange. I
Right.
used to do the webinars in our state with the lots of webinars. I have done counseling the adolescent, counseling the pregnant mothers, and there's a program Sathi. Have one program called Ma program. Na? Ma, I think it's
Okay.
the program's name. And we used to have monthly basis of pregnant mothers. They used to come and I used to be there as a guide, and they used to have some problems, so we can discuss. So we can do if people think webinars and all, they can help the others, because others
Right.
is a challenging thing.
Yeah. Lakshmi ma'am is from Gujarat. She's from a center in Surat. I'll request COE BGMC to take this session in Hindi, ma'am, for now.
Okay.
And
Yeah, as
yeah,
far as possible for me, I can do it in Hindi, but
yeah,
100% may not be possible. Some words I have to use. मैम, adolescent HIV child और non HIV child में खाली और ART का फर्क है, बाकी हर इमोशन सेम है,
जी,
जिसे हम लोगों ने देखा है, कोई लाइफ में जी जाता है और कोई नहीं. हाँ, so you have to make them aware कि आपको HIV है तो आप एक दवा ले रहे हैं, और क्या किसी और को एनीमिया है, वो आयरन का टेबलेट खा रहा होगा, तुमको थोड़ी बताया कि वो आयरन का गोली खा रहा है, वैसे तुमको भी नहीं बताना है, तुम HIV है, HIV की गोली खा रहे हो. किसी को थायराइड है तो थायराइड की गोली खा रहा है, कोई एडोलेसेंट मोटा है, वो हो सकता है थायराइड है, वो थायराइड की गोली खा रहा है. तो ये तो डिफरेंस आपको ऐसी तरह काउंसलिंग करना है, और कोई फर्क नहीं है. एंड यू हैव टू मेक देम इमोशनली स्टेबल, दैट्स अ मोर
जी,
इम्पोर्टेंट थिंग.
जी.
मैम
Ma'am, there's
मुझे
one more question. What about the children who are living in hostels? They are unable to maintain their adherence.
yes, even we have a practical issue of that also we have faced there. So we call the who is taking care of the children, these children in the hostel, कि आपको वहाँ जो आप लोगों को कौन देखता है, कौन खाना देता है, कौन केयर टेक करता है, someone is will be the responsible person, no? So you have to take the parents consent, if the child is older enough and all, so assent also, and then you have to disclose कि he is having, or you might not disclose. He has to take one medicine regularly. This is good for his health. It is he needed. You might not say the HIV, लेकिन कोई उसको बीमारी है जिसके लिए दवा खाना है, और आपको देखना है कि वो ठीक टाइम में दवा खाता है कि नहीं. So you can do without disclosing also. You can do if their parents permits, and the child also, adolescents also, 18 years and all, more than 18 can give the consent also. Then you can give the consent and can disclose if only to the person who is concerned for the taking care of the adherence. This time you can do it.
Right, ma'am. Thank you so much, ma'am. Any more questions? Ma'am, can we run the feedback poll till then? Just
But
another 2 minutes.
what about the clinician,
Yeah,
who are living in the hospital? I answered that. Thank you.
yeah, yeah. Thank you, ma'am. Kiran sir, can we quickly run the feedback poll? Yeah, thank you. Participants are now requested to please answer the feedback poll. There are 5 questions in all. Scroll through the questions and click on the answer of your choice. Requesting all the participants to please add the feedback poll, answer the feedback poll. Dr. Kalpana ma'am, thank you so much for facilitating this important session.
Thank you.
Thank you, ma'am. Requesting everyone to please attempt the feedback poll. The answers are visible on the questions and answers are visible on your screen. Click on the answer of your choice. There are 5 questions in all.
Two people didn't strongly disagree. Session not relevant.
Yeah, just check the last question, ma'am. It is on a 1 to 5. It is 3 to 5. So maybe it was accidental. Requesting everyone to please attend the feedback poll. We'll wait for another 2 minutes. You just have to click on the answer of your choice. Thank you, everyone. Thank you, everyone, for your patient listening. And thank you for the feedback poll also. Ma'am, we'll conclude the session now.
Okay, so we can quit.
Thank you.
Thank you.
Thank you, everyone.